All right, today we're going to be covering the massage stick, so also known as a rolling pin. If you can't find a massage stick, you can actually use a rolling pin, but one of these are actually pretty easy to find online at a local sports store. Even Walmart has been known to carry these things, so they're pretty cheap, so pretty relatively inexpensive. Okay, so we're going to start with the lower back. So you typically want to do about 20 progressively deeper passes. So you start light and slowly increase. Discomfort or pain can be experienced when you find a bump or a tender knot in the muscle. Okay, this is a trigger point. Okay, so about 20 passes. Then we'll move on to the glutes next. Okay. Going up and down there. Again, this is going to be wonderful for back and hip pain. Okay. If you have somebody at home that can help you with this, if you have a spouse or significant other that can help, then you can actually just lie on your stomach and have them do this for you. It's even nicer, but the idea that we're trying to teach people is to be able to do this for yourself. Okay, next we're going to go on to the quads and the IT band. So going straight up and down the front of your quadricep and the front of your leg. Okay. And it's also really nice for the IT band. This is something that we covered in the styrofoam roller section, but this is actually a little easier, especially when you're starting out, because you don't have to have your whole body weight on the styrofoam roll, and you get to start with a little lighter pressure. Okay, next we're going to move on to the anterior tibialis. This is the muscle in the front of the leg where a lot of shin splints happen. So this is a really great way to work out shin splints. Of course, this is after you have gone through the inflammation control portion of your program first. Okay, so just rolling up and down there. It's going to be great for your shin splints. Again, start slow and get progressively deeper as your muscles can tolerate. Okay, then we'll go to calves, right in behind the shins. And just coming up and back down there. If it's painful, just reduce the pressure. You don't have to rush into this. Okay, just take your time, and this is going to be a process it's going to be consistency over time. Okay, you're not going to work out all the knots in one session. Okay, consistency is key. Okay, and then the last two now we have I'm going to have Judy do the triceps. So with this one, you're going to sort of tuck the stick into your stomach in a more vertical position, and then arm in behind, straighten out your arm, full extension of the elbow, and then you can get at the tricep nicely that way. You want to do the lateral head and the medial head, so you can move your arm around and get the entire muscle. And you can also do the front. You can do the biceps by just moving your arm in front. Okay, that's going to help with any elbow problems or shoulder problems. And then last, we're going to do the cervical spine. Just going up and down. And again, starting slow and progressively deeper. You can start with the right side first, come right down to the shoulder, and all the way up just below your occiput, and about 20 passes per side. Okay, you want to place enough pressure to create discomfort but not pain. If you feel yourself tensing or tightening, you're defeating the purpose and preventing the benefits. So make sure that you're not moving too fast, too hard, too fast. A little bit of redness afterwards is normal, but if a bruising appears, make sure that you let that bruising totally heal before you go to work on it again. All right, and you want to follow up your session with a little bit of stretching. All right, everybody, good job, and we'll see you soon.